Hello and good evening. Today's daily video task topic is about a technical topic called blood pressure. In today's video, I will be talking about or explaining the concept of blood pressure with its categories of blood pressure and also factors affecting blood pressure and also how to manage the blood pressure. Now, what is blood pressure? Blood pressure is a force that is exerted by the circulating blood against the wall of arteries, arteries, and as the heart pumps blood throughout the body. It is an essential indicator or parameter of cardiovascular system, uh, indicating health, uh, and is measured in millimeters of mercury, that is mmHg. Blood pressure reading consists of two numbers. The first one is the systolic pressure and second one is the diastolic pressure. The systolic pressure is the pressure in the arteries when the blood pumps the heart pumps the blood, and the diastolic pressure is the bottom number, which indicates the pressure in arteries when the heart rests in between the heartbeats. Now, categories of blood pressure. Blood pressure is categorized as follows. First one is normal blood pressure, where in normal blood pressure the systolic pressure is below 180 mmHg and the diastolic pressure is below 80 mmHg. The ratio of the normal blood pressure is 120 by 80 mmHg. The second one is the elevated blood pressure, in which the systolic pressure is in between 120 to 129 and the diastolic pressure is below 80. Third category is hypertensive stage 1, where the systolic pressure is around 130 and the diastolic pressure is in between 80 to 89. The fourth one is hypertensive stage 2, in which the systolic pressure is around or above 140 and the diastolic pressure is at 90 or higher. Now, fifth category is the hypertensive crisis, where the systolic pressure is around 80 mmHg and the diastolic pressure is at 120. This condition requires immediate medical attention. Now, factors affecting the blood pressure. There are several factors which affects the blood pressure, such as age, and age is the main criteria that affects increasing in the blood pressure. Now, the blood pressure is typically increases with age. Now, second factor is diet. A healthy diet can reduce blood pressure, and some diet containing a high amount of salt intake and excessive amount of alcohol consumption and also caffeine can raise the blood pressure easily. Now, third factor is physical activity. Regular exercises can reduce the blood pressure, while the inactivity or being sedentary can increase the blood pressure. Fourth factor is the stress, where the chronic stress may contribute to higher blood pressure. And fifth factor is genetics. Family history can also affect the individual's blood pressure for developing the condition of hypertension and other heart diseases. Sixth factor is the weight, where being overweight and or obese can easily cause high blood pressure or hypertension. Now, how to manage the blood pressure? Managing blood pressure is important to reduce the risks of heart diseases like stroke, heart attack, and other mm, cardiovascular diseases. Now, there are points to manage the blood pressure, such as one, healthy diet. And a healthy diet, eating a healthy balanced diet can cause lower blood pressure, and a diet containing low amount of salt and high amount of protein can manage the blood pressure at a normal range. Now, second is regular exercise. Now, engaging in the exercises at least 15 to 30 minutes of a moderate aerobic activity at every day, which reduces the blood pressure. The third point is medication. In some cases, doctors may prescribe the medication to help to reduce or control the blood pressure of uh, patient in hypertension conditions. Now, fourth point is regular monitoring. Checking blood pressure regularly can help to manage the blood pressure and identify potential issues or risk at an early stage. Thank you.